Schwartz.
And I'm Connie Mullen, and we're the women of the Wise Women Sanctuary.
And today we're going to talk about how to choose a healthcare provider when you're pregnant.
Exactly. It all starts before you get pregnant. You should really explore what your own philosophies are and what your ideas are that you want for having a baby and where you're having a baby. And once you decide that, then explore what options are available in your community.
That's a really, really good point. I think what we also tell our ladies is interview your healthcare providers. Go out and, if you are interested in a hospital birth, don't just go to your OBGYN that you've known for years, unless you're of course happy with him or her, but maybe talk to other healthcare providers, maybe a midwife, maybe you check out some birth centers and go there and pursue, they offer tours.
Yes.
You can take a tour.
Absolutely. And a lot of communities, at least in our area, also offer licensed midwives who offer home births. So it would be important to check those out, even if you're not considering it.
Yeah, that's a good point, because even if you're saying, home birth is not for me, but you learn about new options, you might get new ideas of what to look for in a healthcare provider, and you say, I like that kind of care, but it's maybe not for me, but I get a better idea now what I want and move into that direction.
Exactly. Now, if these ladies are interviewing the different healthcare providers, what do you think are some questions they should ask of the healthcare providers?
For example, how much time they offer each lady. Some healthcare providers are very generous with their time. They're having a 30 minutes time for appointment up to an hour, for an appointment. How often the ladies are being seen, what kind of testing they're offering, what if the ladies don't want to have any testing done.
What tests are optional?
What tests are optional, exactly. What can you think of?
I was thinking also if it's a larger practice, it might be important for them to interview each care provider in the practice, because they will probably have similar philosophies, but there will be certain things that they have different philosophies. What hospitals, if a woman's using hospital birth, what hospitals do they have privileges at? How available are they after hours?
Very good, yes. Availability is a really, really important point too. And maybe also what other resources they offer. Do they offer classes, prenatal classes, childbirth education?
Yes. And are they included in the care, or are they additional fees?
Yes, exactly.
Which brings us to the insurance as well. If a client or a woman has insurance, does their insurance cover these certain aspects of the care that the care provider might provide?
That's a very good point, And then also, a really good point what Connie brought up early is to interview or think about your options before you get pregnant. That way you can also financially budget, what, for the fees that are coming and so forth.
Exactly. And another thing we like to bring up to ladies is, even if you've started with a care provider, if you're through the care and the visits and you're finding you may not be quite clicking with that care provider, you always have the option of finding another care provider, whether it's in the same practice or a totally different practice, or even a birthplace.
Very good point. Very good point. Also, talk to your friends, and maybe have some girlfriends, some sisters, some other ladies who've gone through pregnancy and said, I know this really great healthcare provider, I know this really good doctor, midwife, or who is really wonderful. Why don't you check him or her out? So talk to other ladies in your community.
Absolutely. Well, great idea, Kristen. Glad you brought that up. We're the women of Wise Women Sanctuary. I'm Connie Mullen, midwife.
And I'm Kristen Schwartz, also midwife. And please check out our website at www.thewisewomensanctuary.com.
Thank you.
See you next time. Bye.